Hello, James here in Kenai. We're moving along with the measures. We're moving into some of the STD bundle, and that would be a prenatal HIV screening. So basically what GPRA is looking for is all active clinical patients with no documented miscarriage or abortion during the past 20 months and no recorded HIV diagnosis ever. So basically, if you're prenatal, normally sites have this just a part of their policy. It's just we're getting blood work done, and this is one of the tests that are within the blood work, and we're looking for HIV. So the numerator is basically patients who were screened for HIV during the past 20 months that happen to be prenatal or pregnant. And there's also another measure, which is HIV ever, and what that basically is a CDC recommendation, and this is in development, a developmental measure, but it's basically having at least once in a lifetime HIV screening. So a lot of sites and clinics are actually doing both of those, and they're incorporating it kind of as policy. They're clinical policies, and so we screen this all for this. We do when we do our blood work, and this just happens to be it, and you can opt out. I'm going to show you a couple places real quick in EHR where you can do that. Again, you can go up here and you can just type it in if you know what it is. You could also create a pick list. So here there's an STD, and within the STD pick list there's actually an HIV 1 and 2 result. And then down here, again, if you ask the patient, let's say you're doing HIV ever, and you ask if they know their status, and they say, yes, I do. I had a blood test done last year at A&MC. You can come up here and you can add that historically. So you can basically come up here, put in the date, and where it was performed. All three of those will basically satisfy that GPRA measure, and you will meet that prenatal HIV screening measure. Thank you.